Hi everyone, my name is Ron Barton. I'm an international management consultant and I've been working on healthcare reform in the US for the last 25 years. And it's driving me crazy. Well, what we're going to talk about today is what are the next steps for US healthcare. So what am I specifically going to talk about? We're going to look at what the key facts are. And you're getting lots and lots of distortions of the key facts in the vested interest groups media right now. We're going to be looking at what we should be going to next. And there's a lot of talk about going to Medicare for everybody. So what are going to be the key takeaways that you're going to get from this presentation? The things that really need to stick in your mind. Number one, competition alone isn't going to fix the problem, but an integrated, non-competing delivery system will. So despite what you're hearing from the politicians and all this pressure on competition in healthcare, that isn't going to work. So let me show you why. Here's the scary stuff. Experts agree that our healthcare system's riddled with inefficiencies, excessive administration, expenses, inflated prices, poor management, and inappropriate care, waste, and fraud. These problems significantly increase the cost of medical care and health insurance for employers and workers and affect the security of all the families in the US. That's from McKinsey, one of the most respected consulting companies in the world. And the reality is, unfortunately, probably worse than they're portraying. So here are the two key facts that you need to understand to get a clear picture of how we should move forward. The first is, most of healthcare is not a supply and demand economy. You're not qualified to know what you need, typically, and you have very little cost or quality data to differentiate between competitors. If you can't differentiate between competitors, then, in fact, competition isn't going to be effective in maintaining an efficient market and keeping costs down. So competition alone is not going to fix the problem. The major cost driver in the US healthcare system is just the inefficiency of the way it works together. So let's look at that. All other developed countries have regulated elements of a healthcare system that are working in cooperation, not competition. All of them. These all use healthcare resources efficiently and effectively to meet the geographic and demographic needs of the population. And they do it by having a healthcare resources plan that actually looks at what the population's requirements are. The US doesn't have an optimally designed healthcare system to meet the people's needs because the goal of the system is to maximize profit. The object of our healthcare system is to meet the needs of the providers, not the people. And that's the very key point that we need to bear in mind. Okay, let's look at an example of what that means. So here's a group of hospitals in New York, all in the same area, all delivering costs for the same treatment. You'll see that the Lenox Hill Hospital at the top is charging $24,000 for the same treatment as the Metropolitan Hospital Center is charging $6,000 for. So there's a multiple of 4 times. So if competition is working to control cost, explain to me how Lenox Hill can stay in business if they're 4 times the cost of their competition. So we're back again to the fact that competition is only effective if the consumer has A, the ability, and B, the data to differentiate between the different providers. Here's some examples of just how bad the US system is compared to other countries. So this is the cost per day of hospital coverage. So we're looking at something over 4,200 as an average in the US, right down to Spain at 476, France at 853. So we are much, much higher in cost than any other developed country in the world. However, as we'll see later, their outcomes are every bit as good as ours, and in most cases better. Here's just the overall healthcare cost by country. The US is about 2.5 times the amount that the average of all other developed countries in the world in the total cost of their healthcare. However, despite the fact that we're charging double what any other country would, our outcomes are not as good. So here's an interesting Forbes article, which you can go to and check on, where the US actually ranked dead last when being held up to 10 other developed countries. Okay, so we've talked about the fundamentals of driving cost and the lack of effect that competition has in giving us an efficient healthcare system. So let's look at a couple of other things that people forget. 50% of all Americans are on government-paid healthcare. Politicians, prisoners, armed forces, all federal and government employees. That's 50% of the population. So what does that mean? Unlike all other developed countries, the US government isn't leveraging its bulk purchasing power. So that means that the marketplace in the US is ideal for where pharma companies particularly can make the most of their profits. So nearly all the world's pharma companies make the vast majority of their profit in the US. It's the only unregulated market. Right now, there's a congressional hearing going on with a pharmaceutical company that cranked up the cost of its drugs by over 1,000%. Why? Because they can. We're in a for-profit system. It's our fault that they do it. It's not theirs. That's the system that we've chosen. So, our wonderful for-profit system is now consuming 50% of all of our taxes. Not only is it consuming 50% of all our taxes, but that's going to increase at 6% a year for at least the next 5 years. That's the forecast. So if we want to save tax, we want to pay less tax, one of the key things we need to look at is the efficiency of our healthcare system. That's what's burning 50% of it. 20% of all consumer spending is going on healthcare. Not only that, but 62% of all bankruptcies, and they're at a record high, are now being driven by healthcare costs. People are on high deductible plans, they can afford to pay the premiums, but the deductible that they have to carry to get the premium they can afford is often more than they can pay for. And that is just driving bankruptcies. So what are the next steps that are realistic? The one that's being talked about a great deal is Medicare. And Bernie Sanders has come up with the idea of putting Medicare as the healthcare provider for everybody in the US. It's not something we can just flick a switch and go to, but it does seem to be the most practical alternative to come up with a much more efficient healthcare system. So Medicare has the infrastructure in place, but there's still the issue of a competing delivery system. Now, although the system is still regulated more under Medicare than it is under non-Medicare plans right now, you still have a scenario that the providers there are not matched to meet the specific needs of the people. So if I use Georgia as an example, about 600 people a year die in Georgia in the rural districts because they can't get to a trauma center in time. Well, why can't they get to a trauma center? It's because it's not profitable to have trauma centers in the rural areas. So we need to have some other way of making sure that providers are not just going to center themselves in places where they can make a profit, but they're going to make services available where people need them. And that's going to be a difficult task that we need to plan for over a period of time. So here we've talked about meeting the demographic needs. Here we're talking about incenting the change to the way they work together and come under a regulated cost structure. Medicare already has some regulations in place, which of course the healthcare industry hate, to contain costs. That structure is going to have to be extended, and the regulation on cost has to be strong enough to force the facilities to be more productive and efficient to be able to operate under a constrained cost structure. So, finally, Medicare, if you included more people, by definition, is going to have a younger population. A younger population uses the healthcare system less, and it would overall become cheaper than it is now. So you're thinking now you're paying a Medicare tax. You would go away completely from healthcare billings. You wouldn't have to deal with insurance companies at all. You would have to pay an additional tax. However, the tax difference on average between what private premiums are now would save the average person about $5,000 a year. Why wouldn't you do that?
Hi, this is Ira, and I've got some questions. So let's actually go back to this notion about the market economy. It'd be my understanding that most conservatives would not agree with the statement that healthcare is not a supply and demand economy. Would you agree that they wouldn't agree with that statement?
One of the barriers to change is the American culture and the fascination with the capitalist system. And that has stood us in great stead. We're not the world's largest economy for nothing. That concept of market forces and competition works very well in 99% of the cases in commercial business. However, the problem you have with healthcare, which is the point that I was making earlier, competition only works effectively if you have an informed consumer. So if you have the data on cost and quality to be able to choose between providers to give you the best value for your money, and of course you're in a timely situation that you can do it, then that works well. So in LASIK surgery and cosmetic surgery, competition works very well because you make the decision in your time scale as to what you want, and you can choose between the costs that are presented from different providers, and you can look at the consumer ratings and comments on the performance of those particular providers. So in that instance, which is obviously part of the healthcare environment, competition works. It does not work if you're having pains in your chest late at night and you have to be rushed to a facility and a physician has to take over the management of your decisions to keep you alive. The consumer cannot choose effectively in that environment. Right, let me summarize exactly what we've been talking about, and these are the takeaways that I hope that you'll really find useful. Number one, we've showed facts that the US is the only for-profit system, and it's a lot more costly for poorer outcomes than any of the other developed countries in the world. Okay, let's look at the next one. An integrated healthcare system. That means the elements of the healthcare system working together in cooperation, and the actual design of the healthcare resources being made to match the requirements of the people. So here now we've got a system designed to meet the people's needs, not to just provide profit for the providers. Finally, in those cost savings with an integrated system, what we're going to see is a huge benefit to the federal tax bill, because 50% of the people are on government-paid healthcare, and that is consuming nearly 50% of the total tax budget. If you can reduce the cost of healthcare with an integrated delivery system, it will reduce the taxation for all of us. That's a real big plus. Thanks for listening. We really appreciate you sharing this with us. We're aiming to enable this dialogue to be a positive outcome for everybody in this country and to really get healthcare on the right footing and in line with the rest of the world. Thanks for your help.